Dr. Travis, let's stay with children a little bit still here, and with sealants. You know, when do they have to be applied? Do they have to be applied? Are they really very good? Is it something which you definitely recommend? And why? And what's the whole workings about it? Who should have it? Who shouldn't?
Yes. Well, sealants are exactly what they sound like they are. Mm-hmm. They're just, think of it as a varnish coating. Well, that's not varnish, but think of it as that. That goes over the grooves of your teeth. Now, as you know, anybody who looks in the mouths, their teeth have hills and valleys. So the valleys have a tendency to accumulate food particles and bacteria in there. If they sit there long enough, they form decay. If we can prevent children from the age of 6 to about the age...
So those valleys, are they too... They're big enough for some food and bacteria to go in, but not big enough for the toothbrush to go in? Is that... Because otherwise, I mean, you brush them, right? I mean, if a person brushes, you shouldn't have that problem.
Correct. Some of these valleys are definitely more steep than the bristles of your brush. Mm-hmm. So you really don't have a good way to get a handle to get the bottom of the V. Mm-hmm. So it's a good idea to seal those off early on in life. If between the age of 6 and the age of 18, which are the high caries years, if you can avoid that child, that person, from getting cavity in their molars and bicuspids, there's a very, very good chance they will not get cavities the rest of their lives. There's another stage in life that becomes a high caries age, and that's the last 10, 15 years of our lives. We go back into a high caries formation stage.
Really?
Yeah. And we don't do sealants there. I don't know why, but we don't. But the type of caries we get there is a little different. It's more along root surfaces because our gums recede, and also we have less saliva in our mouths. Our pHs often go down, and we take many medications that alter these things. And so because of those two factors, we tend to, once again, develop a lot of decay in the last years of our lives.
Interesting. Never heard that before.
But if you can save your child from getting a cavity, and a sealant is usually very effective, and they last, pretty much as long as they need to be there. A better part of 10 years, they usually tend to last about that. Sometimes maybe 7 years, sometimes 6, and you have to redo one. But it's no big deal. It's not an invasive technique. It's really just a painting over. And it works very, very well. Yeah.
So when you said 6 years, so that means obviously they get put on the second teeth, not on the first ones.
Yeah, no, this goes on your second teeth.
And they go on the second teeth as they have relatively or completely fully developed.
Yes, exactly. Once the primary teeth, the secondary teeth, the permanent teeth, have erupted fully, that's when you want to go ahead and seal them.
Good. And then at cleanings and stuff, the dentist would check whether they somehow are defective, like you would check your tire on your car, like, okay, good, we're fine, right? Something like that?
Yes, something like that.
Okay. Good. All right, thank you very much. So you welcome. Do recommend sealants. You just,
very, very important.
It's a good investment.
It's one of the best investments a parent can do for their child.
Beautiful. Thank you very much.
You're welcome.